Hello again, everyone. This is a video regarding demonstrating the GA major macro. So when you see that, you have to choose the patient here. So the patient is chosen. In normal situations, when you are in theaters, in the real domain, this would say a tick box here to say that the nurse or ODP has already checked in the patient. And this tick box is created only when you create an anesthetic record for the patient. So these are old patients, and this is the one we're going to create a record for. So I click on that. So as soon as the patient comes into the anesthetic room, you have to start the macro before you do anything. So you click on that, press OK, select the patient, and then it will confirm the patient with you. Make sure it's the right patient, no drug allergies. Allergies is not recorded, so we'll have to record that or look at that to make sure that the patient is not allergic to something we're giving. So you click that, and then that's to confirm that you have the right patient. This is the point where you will be asked to choose the monitor. So the present plan is to have monitors named with names of people. So if you see the monitor block on the anesthetic room, it might say something like Oscar. So you would click that name there and then press OK. And be aware that it may be another one in theaters, in which case, if you are changing to a different monitor, you may have to change over. And there'll be someone on the site for the first few days to help you with all this. So don't worry too much. But we may have to suspend the case and restart the case in theaters. That's what we'll have to do. But for now, I can't do that. So I'll have to press cancel there. And then wait for the paperwork to load. If there are any infusions or medications continuing, you will have to choose them. But in this point, we're not doing that. So again, please familiarize yourself with anesthetic solution views video first, so that you know what these buttons stand for, because I'm not going to say that again. So once we have opened this, one of the easiest way to get into the anesthetic chart, if you want to see the drug allergies or record a drug allergies, is quickly press the patient record button. Normally I would open that only in theaters, but in this case, because the allergy has not been recorded, but this wouldn't happen, because in real life you would have seen the patient in pre-assessment and you would had a chance to record the allergies. So this is where you go, and then you go to allergies. Just choose no allergies and OK. Or if there is an allergy at this point, you can ask the name of the allergy and then ask the patient. And I'm quickly refreshing to make sure it gets saved. And then I'll just leave it open because I'll need to go back to it to make some prescriptions. So this is the patient we have. And then we'll have to start the macro. So you go on to macros, and then you have to choose the GA majors, Shri GA major macros. The Shri won't be there, it'll just be GA majors. And then it'll give you all the list of things, and press execute. So all the things will come into the to-do list, and we just need to move this up to see the top of the list. So uploads, when it uploads, it goes to the bottom. So just drag it up. So this is how it starts, and then you start getting numbers. These are kind of fake numbers. Just make sure that the fake number thing has been switched on. This is something you won't have to do. It's just to make it look a bit more realistic. So when a patient comes into the anesthetic room, you started the macro. That's the time for you to put in the cannula, attach the monitors, put in the cannula, and then go for washing your hand if you plan to give a spinal. So the macros will start recording the numbers once the macro is started. So the numbers will all be there. And then you come back and do the spinal, and then you do the GA. Try and remember the times you gave the spinal and the GA, because that will be helpful for us when we come back to record. So that's what you have to do with this. And you remember that the GA majors macro has got more monitoring. If you see here in the monitoring box here and scroll down, you'll see that it's more, it's got the monitors like Lidco and blood gas and BM and so there are some extra monitorings in here. So we don't have to go, and you can enter them here, but it's more easier to enter it using the document button. I'll show you in a minute. So now we got this. So what we do is we go monitors. Once you're back, you can document it to the time when we started it. That is like, let's keep it as 1809. So you go to monitors, right click, edit. Like I told you before, these are the things I usually check. So having seen the list before, have a look at the list, see which things you normally click, and then choose the time and press execute. And again, for peripheral IV, right click, edit, hand, left, 16 gauge, chloroprep. If you give local, you can write local. Occlusive dressing, cannula flushed, no complications. Let's keep it as 10 past 6 and execute. And then the spinal bit, edit. And then let's say we gave it at 10 past as well, just to have some time there. So I'm sure you'll be able to see the time or record, note the time and come and do it later. Sitting position, clohexidine, midline, L34, sprot, 24 gauge, 9 centimeters, 1 attempt. If there are any paresthesia or if you want to write detailed comment, that's the box for that, to write detailed comment. So you would not be doing it in real time. You'll be more likely to do it after you come back, unless there is a second person to type it in for you. So the here is the bit that you have to document the medicine that's given, and that's not here because I don't know what each one uses. So you'll have to go into the documentation, and then you'll have to go into the medications, and then you go into the local anesthetics. So let's say I give the heavy Marcaine, the 4 ml one, that's a heavy Marcaine. I click on that. Here I'm allowed to double click and it opens a box. And usually I give a smaller dose, like give 2 mls. Let's say we gave it at 10 past. So I click OK. And then we need to, if I added some opiates, I'll go into opiates and then say diamorphine. And because it's not pre-set up, we'll have to write this. So this is 0.3 milligrams intraspinal. And I'll choose the right time. Just keep the left button clicked and move it to the time you want. And press OK. And then you go back to the to-do list, which is on the left side. And then you have to document. Once you're happy with the block, you document edit block and what kind of level you had. So I usually give it just for the diamorphine. So my blocks are usually lower because I don't want the local anesthetic to drop my blood pressure. But whatever your practice is, just document what you do, and there's usually not much that much of motor weakness. So these things are not relevant. So we are going to give a GA. So choose the right time. So sometimes write in this bit. I sometimes write patient has numbness in legs, just to document that I feel that it's gone into the spinal and I'm anticipating it to work. So the next bit, again, all this can be done after the patient is asleep. So it can be done in theater. If you're doing it that way, you have to remember to suspend the case, which I'll show you. And when you suspend, you have to, it'll ask you a question that whether data needs to be stopped. And you have to choose unselect all because you don't want the data to stop. And then press OK. So again, the intubation bit is also straightforward. Just right click, edit intubation. So place within theaters, oral, regular ETT. Let's say it was a 7 size tube and it was taped, breath sounds, capnography, chest expansion, and I had a grade 1 view. I didn't use a bougie. I used a size 3 blade. I did not use any of the special, I additional procedures mentioned here. I did use a water-based lubricant, if you use anything else, you can always document that. If there was trauma, you can write a comment. So let's say we did that at 12 past, and then press execute. And if you put the if you gave propofol and fentanyl for that, you just need to write it in there as well. So how much propofol you gave? Let's say we gave 200. Choose the right time. Press execute. Fentanyl. Edit. Let's say I gave 200 of that as well. Sorry, 200. Choose the right time. Execute. And the rocuronium. Edit. Give 50 of that. Choose the time. Execute. So the arterial depends on when I put it in. If I put it in before I gave the spinal, I could put that in at that time, whichever time. But let's assume we put it after the patient was asleep, so I put it after. So we put a radial arterial line, BD plastic, left side, 20 gauge, chloroprep. So I gave 1 ml of local anesthetic, and patient was asleep at that time and no complications. So you can, whichever is appropriate to your case, you can choose whatever you want. If you put in a central line, you can put it in. But if you don't put one in, you don't have to write that. Then the other things like dexamethasone and all the things you gave, you can dexamethasone, because it's 3.3 milligrams. I usually go for the volume. It's easy to put the volume you gave. And just choose the time. I gave it just after intubation. And then I see that the ondansetron is not there in this, so I'll add that to the list as well. Then if you gave paracetamol, you can prescribe that. If you gave diclofenac, you can prescribe that. And the reversal is for the end. The supine position is something we need to add as well. So again, if you do something special, you have to, usually there is safety straps. If you do any special tilting or Trendelenburg, reverse Trendelenburg, or you can write all that there. Whatever you did, you can. If you want to write a comment, you can as well. Just have to change the time to the start and execute. Eye protection is important in GA, so I'll write that I tape both the eyes. Eye protection, yes, tape left side, tape right side. If you used anything like lubricant or goggles or anything else, you have to document that as well as start it to the time that we started the GA. Thermoregulation again is important. So right click, edit. If you use warmed IV fluids, or most of the time in these cases we use fluid warmer, forced air warmer, and if you use anything else, you can add that as well. So these are the common ones we use. So press execute. The estimated blood loss, again, if you right click on it and edit, it gives you an incremental option. You can give, if you give 100 ml 3 times, then it calculates the total for you, or you can add the total at the end. So you have options there. So that's good. And the paracetamol and the diclofenac, whatever you gave, you can prescribe that as well. The thing about this is once you start this as a macro, the arterial line is one of the things that is automatically triggered in this major macro. So the arterial blood pressure automatically gets monitored on that. So this one's that's showing is diastolic because it's these are the arterial ones. That's what it looks like. These ones. So they'll come up automatically. So you don't have to do anything if you use a macro. That's a good thing about using a macro. So just to show you how you can enter some of these numbers here, what you can do is just press the document button and press value there. And then that's where you can enter the numbers every five minutes. So if I'll just show you some of the numbers, how to enter it. Just drag it down a bit more. Yeah, for the cardiac output at 1855, let's think I choose a number of 4.5. And for the PPR, I choose a number of 6%. ppv, pardon me. And then for the blood gases I can choose numbers. The blood gases 135 for sodium, 4.5 for potassium, glucose is 8.0, hemoglobin is 120, and that can be done for the other values here as well. The temperature usually pulls through. Loads of data will automatically pull through, like the arterial blood pressure, temperature. But if it's a tympanic, you may have to enter it manually. BM as well, you'll have to enter it manually. But loads of numbers pull through automatically. Because this is set, the demo mode is set only to NIBP. It gives you these numbers. And you can change it from the screen if they are wrong. Even the arterial blood pressure, once it's come through, you can change it. And for these tidal volume numbers, they should come through inside theaters. But in the anesthetic room, they may not work. So if you want to enter these numbers, you can enter them here. But I don't routinely write the tidal volume for all the cases. Or rather, I write it in the anesthetic room once I see it. So if whatever is your normal practice, there is an option of writing what you want. If you want, you can write the tidal volume was 450 here. So that is, and the respiratory rate was 12, and the PEEP was 5. So all these cases can be recorded and press OK. So they have all gone into the record. So you may not see all of them here simultaneously, but that's a place where you enter the numbers which need to be manually entered, and probably won't be doing it more often than every half an hour, I'm sure, for these long cases. So at the end of the case, you would do the normal thing of you do the normal thing of doing the emergence and reversal and all that. I'm not going to show you all that because I'm sure you know what I'm talking about. At this point, what I'll do is I'll post the I'll try to show you how it looks in the finalized anesthetic chart, and for that I'll finalize the anesthetic chart and then try and get it into the anesthetic chart to show you what the numbers we put look like. So I just finalize that for you there. And at this point, it says it's going to stop the data. That's what we want, because we are stopping theater monitoring and going into recovery, because I'm assuming that my case is finished now. I know it's a bit too early for a major case, but obviously you will also have to do the SBAR handover and the post-op prescriptions, which you have already been shown how to do. But I'm not doing it because I know you've seen the other videos and know how to do it. So at this point, I'm just stopping, and the main point of making this video is to show you how the numbers look like in the finalized anesthetic chart. So you have to make sure that you don't want to put any of these numbers or details in. If you need to, this is the time to go back and do it. And because I'm not planning to enter them, I'm choosing that. And then you have to sign your name to make sure that it's you who is doing the anesthetic chart. Press OK. That won't be there in the real life, so don't worry. And once I've signed it, I am able to finalize. Finalize button is just under the sign button. And then I've already got the anesthetic chart open there. So just pause for a second, and then I'll show you. Now we go into the power chart and just drag it down and go to surgery workflow. And then you got the anesthetic record there. So just click once on it, and then that'll double click rather. That'll open up the anesthetic chart for this patient. Let's give it a minute to upload. So this is just to show you what it looks like on the anesthetic chart. Taking a bit of a minute. It's because it's on the build domain, and that it's not directly the same location as where we are doing it, which will be in the live, and so it will be faster. And this is what it looks like in the finalized anesthetic chart. The 4.5 I put is here. The PEEP I put 5 is here. If I drag it down, the numbers I put are all here. So it's there every 5 minutes. And that's what it looks like, the blood pressure, heart rate, and the various things we did, the anesthetic start, the monitoring safety entry we made, IV, spinal, block assessment, intubation, arterial line, supine position, eye protection, thermoregulation. Also the other bits, when if we entered it, the other bits like the emergence and reversal and all that will come as well. And because it's a long case, this is the kind of case where you have loads of time, so you have time to do your post-op prescriptions before you finalize it and do your S-bar handover. Because this, I was just trying to show you what it looks like on an anesthetic chart once we have put in these numbers. So hope that's helpful. Thank you.